Hello, everyone. Welcome to the AAIDD and HRS webinar titled COVID-19 and People with IDD, Taking Action to Mitigate Risk. I am your presenter for today. My name is Craig Escude. I am a board certified fellow of the American Academy of Family Physicians, a fellow of the American Academy of Developmental Medicine and Dentistry. I've worked in the field of healthcare for people with serious mental illnesses and intellectual and developmental disabilities for over 20 years. I was the medical director of Hudspeth Regional Center in Whitfield, Mississippi. I retired from there in 2018. While I was there, I created a program to educate and train clinicians in the field of IDD healthcare called Detect, and I am currently the president of Health Risk Screening. So let's get started today. What do we know today about coronavirus? And I stress today because things are changing on a rapid basis. So I always encourage you to look for resources for the most up-to-date information. But we know that the coronavirus, the issue we're dealing with today is caused by a coronavirus. COVID-19 stands for, the CO is corona, VI virus, D disease, and 19 for the year that it was discovered, which was December of 2019. Coronaviruses as a whole were first discovered in the 1960s, but they've likely been around for hundreds or maybe even thousands of years. Coronaviruses, there are different types. Some of them many of them are responsible for simple illnesses like the common cold, and they're thought to be responsible for about 15 to 30% of common colds. But some strains like the COVID-19 and SARS can be more dangerous. There are other viruses that have higher rates of death. Ebola has about a 50% rate of death, and then SARS and MERS both are coronaviruses as well. Ebola is not, the others are. Also has significantly higher rates of death than COVID-19 than what we're dealing with at the present time. There is no current vaccine for COVID-19, but we know that people are actively working on this right now. So when we talk about the risk of serious health effects, in general, when we look at what the CDC says, people who are over 65 with lung disorders, heart disease, immune deficiencies, and severe obesity all are at increased risk, not from contracting the disease, but from having serious consequences from the disease. Some people with IDD have issues that affect their respiratory capacity. Some people with cerebral palsy may have they may find it difficult to fully expand their lungs or to cough effectively. Many people may have asthma. People who have had frequent episodes of pneumonia in the past, say from aspiration, which we know occurs more readily in this group, can have damage from their lungs from repeated episodes of infections. Some people with IDD have chronic silent aspiration, where they are aspirating contents into their lungs. No one really notices it because they're not having symptoms. But again, this can damage their lungs, which can create an increased risk for severe illnesses. So we're going to talk about some scenarios today. We're going to talk about a person in a group home who's been diagnosed with COVID-19, a DSP in a group home who's been diagnosed, a person who just has symptoms, a staff member who's been exposed to someone that was diagnosed. We'll talk about people that are being moved to another group home when staff don't know them, maybe to be quarantined, and also just about social distancing and how that affects people differently. And we're going to start from the bottom and work our way up. So we're going to start off by looking at just the simple fact that everyone, including people with IDD, are being asked to practice social distancing. So first, what is social distancing? Basically, it's avoiding close interaction to reduce contact to reduce the spread of a particular disease. We contrast this with quarantining, which means restricting people's movement that have been exposed. So we know a person's been exposed to the disease, so we're going to restrict their movement to try to limit spread. And then we also look at isolation. Isolation is what we do when we're separating people who are ill with a disease from those who are not. So just to make sure we're all on the same page with that, what we're talking about now is social distancing and the effect on all of us. So what does it mean? We no longer can have visitors. We don't have family members, maybe, or friends that we can visit with. There's no large crowds at all. So no work, no school, no social activities, no church. Eating in smaller groups might occur, or even having to eat alone. And we are social creatures. So these types of things can have unwanted effects. Greater social isolation in a group of people who have been really fighting for increased inclusion for many, many years. But again, for all of us, as we're socially isolated, we might become more anxious, worry more, have more fear, become lonely, anger, have boredom and depression. And in people who express themselves in ways other than with words, we might see adverse behaviors that can be a result of these types of situations. So, are there things that we can do to combat that? And the answer is yes. We want to stay connected with other people in the best way we can. Using social media can help. There are video conferencing platforms such as Zoom and GoToMeeting and Skype and all of these things, and a number of them are free, that you can schedule regular conference times with people and their family members that can help keep that interaction going. Don't forget about snail mail. Interacting in that way can provide activities such as creating cards and putting together items or pictures and writing letters and sending them off to family members and friends. And you can even send them off to other people like healthcare providers and others who might be critical workers who are really struggling at this time, to provide them some words of encouragement. Something like an Xbox or other video game platforms can provide um, uh, information, a connectivity in that way as well too, because sometimes you can get together on these devices and play games with other people. So that's another way to interact. There are phone applications such as House Party and Hangouts that can help people interact together as well too. We also want to practice relaxation techniques. We want to keep exercise going because we know that exercise is helpful and mood elevating. Practicing things like yoga. Let's say we want to do an activity. Well, maybe we were going to the zoo. We can do a virtual tour of the zoo or virtual museum tours. And there are a number of these types of things out there now. Writing activities, games, and music can all be good. Consider having themed events or meals. Let's say we're used to going out to eat once a week on a Friday night, and we go eat Mexican. Well, maybe we can create a Mexican atmosphere with music and create some decorations and all participate in cooking various parts of a meal and have a themed event at home. We always, modeling appropriate behaviors is good for staff. If staff are modeling appropriate behaviors, it can be very helpful, and it can spill over into the mood of the entire place. If people are modeling panicky and anxious behaviors, that can also spill over. We want to keep routines the same as much as possible as well. And there's a resource that's available for you on the SAMHSA website, which is the Substance Abuse and Mental Health organization. SAMHSA.gov has a document with tips for social distancing that I think can be helpful to everyone. So let's move up the ladder on the next scenario. Two people are being moved to another group home with staff who don't know them. And you can kind of generalize this and say that people are being moved somewhere. It could be a hospital or some other environment where people don't know them. And one of the best things that I think we can do is to provide the new support group, whether it be healthcare providers at a hospital or another group home member, or we have different staff coming into the group home, that we provide them with concise and practical information. And this would include clinical information, but also social and environmental information, anything that we know that can help others support the person better. And one thing that's out there that I would recommend that you consider using is something called a health passport. Many of you may be familiar with this. A health passport has basic demographic information, but it also provides basic medical information as well as social and environmental things that can help support a person. How does a person communicate? How do they express pain? How do they take medication the best? What are their mobility needs? What helps people calm down, and so much more. And it shows that people with IDD are people first, and that is very important at this time, especially as we're looking at the possibility that there may be different levels of care provided to different people. We've already heard in the news about some states suggesting that people with cognitive differences may not be as high up on the list for certain types of services, and we want to combat that in the best way we can. The HRST My Health Passport is a document that is available on our website at hrstonline.com. You can download that and use it and fill it out. It's a PDF fill out document, and it contains the basic information like you see here, like demographic information, who their doctors are, some important clinical information, but also it describes how the person interacts with others. When I experience pain, how do I usually show it? What do I do? What type of assistance do I need with eating and drinking? How do I communicate? Words or gestures, or you know, how do people describe me? What do they say that what do they say that I like or do or interact? How do they look at me as a person? What do I like? What do I don't like? How do I react to those things? What can you do to help me calm down? So this type of document to me is invaluable to have available and updated at this time. So let's move on to the next scenario. So a staff member has been exposed to someone that was diagnosed with COVID-19. So here we have is what we have is let's say a direct support professional who provides care in a home environment, has been exposed to someone who is diagnosed with COVID-19. Let me first preface this by saying that it's impossible for us to cover every scenario here or every aspect of every scenario. So my goal here is to hit the highlights of different things and then provide you with some resources. So when we look at this situation here, the first thing we want to do is look at the agency's policies. And I know that many of you out there have developed a number of policies. And those are very important to look at. And we need to always reassess our policies and make sure that they are based on the most current and up-to-date information. But there's a strong possibility that a person who is exposed to someone else would be recommended to be quarantined. And that is most likely what should happen. But there's other options out there, other things that are being done because of the critical need for direct support professionals and others who work in this field. Another option might be to monitor their temp and signs and symptoms every 4 hours while they're at work, so that immediately if they develop symptoms, then at that point they could be sent home at that point. I'm not recommending one over the other. Ideally, it would be best if we had enough staff to cover every need, but we just don't do that. So we need to do the best that we can. We certainly would want to limit visitors of that person who has been exposed to someone else. Keep, again, at least 6 feet apart, or maybe even more, if at all possible. So those are some things to consider. I mentioned agency policies, and I want to give a real shout out of thanks to Julia Allman, who's the CEO of CAIDS in Pennsylvania. They've agreed to share their policy with us today. You can, most likely, since this is a recording of the webinar, you can find this on the resource page for AAIDD and HRSTonline.com. But they have some very specific guidelines that were just updated a few days ago based on the most recent recommendations. And again, you can look at these and use these to help you formulate your own plans and guidelines and what works for you in your own situation, but just make sure to keep them updated because things are always changing. So let's look at another scenario. A person in a group home of 4 people has a fever of 101 and a cough. All right, so what's our first thought? Our first thought is they have COVID-19. So what do we first not want to do? We do not want to panic. Remember, not all fevers are COVID-19, and most people who have the disease have a mild case of the disease. Most people are not going to need a lot of care and support. One of the first things I would caution you not to do as well is to immediately send that person out to see a healthcare provider or to an emergency room. Um, at this point where we are, uh, when we move someone to another location, we're most likely going to increase the risk of exposure for a number of people. If we bring a person to a hospital, that's where a lot of people who have it are going to be. And we're adding other staff and increasing the need for staff to be able to do these things. So the first thing you really need to do is contact your primary health care provider. Um, if possible, I would really recommend using telemedicine. Telemedicine allows you to interact without leaving your home. A lot of requirements have been relaxed, and I'll touch on those in a minute. And also, if you're going to use telemedicine, if you can utilize clinicians that have training and understanding in IDD healthcare, I would highly recommend it. Even if it's not in telemedicine, anytime you can find clinicians who have training. I'm going to recommend Station MD to you. I want to make it very clear that we do not receive any benefit from them for utilization of their services. But the physicians there are trained using the curriculum in IDD healthcare that we've developed here at Health Risk Screening, which is meant specifically to provide healthcare providers with a basic understanding of the healthcare needs of people with intellectual and developmental disabilities. When talking about telemedicine, the Department of Health and Human Services has expanded telehealth access. Medicare beneficiaries can receive a wider array of services. They can utilize any non-public facing remote communication device. There's reduced or waived beneficiary cost saying, and it's not limited just to diseases like COVID-19. That's the federal level, because the federal government controls Medicare. Medicaid is controlled by the state. And so each state has broad flexibility on what's covered. So you would need to check with your state's office as to what is covered and allowed as far as telemedicine services, as things have likely changed in the past few weeks. So check with your state offices and Medicaid offices as to what's allowed and covered. The next thing you might want to do is to listen to what the healthcare providers and the agency policies recommend, of course, but you may want to continue to increase or continue your sanitation, but you might want to step it up. So if a person has symptoms, instead of cleaning the house once a day, you might want to clean the house twice or 3 times a day, as well as hygiene and preventative measures. Immediately, if you're not already wearing a mask, put a mask on the person who is ill. This can help reduce the spread of droplets from coughing and sneezing. Um, quarantining the person at that point is likely indicated. Again, refer to what your healthcare provider's recommendations are. Use their own room, if at all possible, with no one else in there, and their own bathroom if the person is not hospitalized. Again, most people who have this disease don't require hospitalization. So you don't want to immediately send someone to the hospital because there's a very good chance they're going to come back, and all that would have happened is we've increased everyone's exposure. So contact your healthcare provider first. If a person just has fever and coughing, whether it's COVID-19 or anything else, they're not going to be hospitalized. It's not until you get into severe problems where a person needs to be hospitalized. And again, you would also utilize personal protective equipment, maybe at a higher level if you have someone that had symptoms. So let's look at another scenario. A direct support professional in a group home has been diagnosed with the disease. So it's confirmed that the person who works in the home has the disease. First thing I want to say is that direct support professionals are the backbone of supports for people with IDD, and they're often underappreciated. There is a legal question out there as to whether or not they're considered essential healthcare workers. I can say this, they're definitely essential, and they're also in very high demand. The legal definitions I cannot speak to, and they change. Again, they're changing constantly, and interpretations of them, we'll leave that to the lawyers and the legislators. But I can tell you they are definitely essential and should be treated as so. Again, continuing to look at steps. If that person has been diagnosed, they really shouldn't be coming to work. They should stay home and they should seek medical attention and follow their healthcare provider's recommendations. Other people, though, in the home where that person was diagnosed, most likely should be quarantined for 14 days. This is really easy to say. It's really difficult to put into practice because there are so many different situations and staffing needs. And I've heard of different things happening. I've heard of in some states that the health department will come in and say that everyone who is in this home, now that this person's been diagnosed, must be quarantined in this same home, including the staff members, the support staff members. And they're being required to be quarantined in the home for 14 days. In other states, I've heard that people are quarantined who live there, but the support staff are being allowed to come and go. Again, it's very different in different situations. What's the ideal? What's perfect? Well, a full quarantine would be ideal and perfect, but it's not always possible. So we need to do the best that we can and still know that even if it's the best that you can, but it's not the absolute best situation, you're still doing better than doing nothing at all. So remember that. This is also a good time to consider remote supports that can expand physical manpower. There's been a lot of advances in technology over the past years and remote monitoring and supervision and interaction with people without having to have people actually on site. This is a good time to look at places, companies like Simply Home and other places that have monitoring our abilities to provide remote supports for people. So another question you may have is, when can a diagnosed person, a person who is diagnosed with COVID-19, return to work? Well, I would say that, again, these may change, but right now what's out there is that if the person was diagnosed and they had symptoms, you've got a few conditions to meet. First, all of the symptoms have to have resolved, and there be no fever without the use of fever-reducing medications, meaning you can't say you have no fever if you've been taking Tylenol around the clock. You have to be off of Tylenol for 3 days. Then also that they've had improvement in any respiratory symptoms that they may have had, and then at least 7 days from the onset of symptoms. So let's say a person only has symptoms for 1 day. They were diagnosed, they only had symptoms for 1 day, they were better, they haven't had fever in 3 days. You still need to wait at least 7 days from the onset of symptoms. If a person has a positive test but no symptoms, and we know that this happens out there because many people are asymptomatic, after 7 days from the positive test, and if they remain symptom-free during that time, then they're usually allowed to return to work. Let's look at the top scenario here. A person in a group home has been diagnosed with COVID-19. So a person who resides in a group home has been diagnosed. Again, seek appropriate health care for the person immediately. Contact their local healthcare provider. Most likely, if they've been tested and diagnosed, they were in contact with the healthcare provider. Considering using telemedicine if you can, or a local healthcare provider. But remember, at this time, only people with significant symptoms like severe shortness of breath are being admitted to the hospital. So don't risk additional exposure if it can be avoided. I am sitting here not seeing the person. I am not giving you specific recommendations on what to do. I'm giving you general things to consider. Always fall back to that person's healthcare provider and their recommendations. You also want to quarantine the other people in the home. They may all have to stay in their room for everything, including meals, which again is difficult. It's not easy. It's very challenging, but it is better to do something than not to do anything at all. If that person who is diagnosed remains in the home, if they're not admitted to a hospital, look at isolating them to a bedroom and to one bathroom. That would include having all of their meals served in the room, not having any visitors in the room. And again, there are people who find it challenging to stay in a room and can have difficult behaviors that can make it challenging. And you may have to consider having a staff person in protective personal equipment remaining in the room with them. Challenges are great in that as well. I understand that. Let's say you have a person in a home, anyone in a home, who has been diagnosed, and then they leave the home, they're going somewhere else for care or for whatever reason. First, immediately sanitize all of the surfaces. And consider increasing the frequency of routine sanitation. Again, if you do it once a day, consider it 3 times a day for a period of time. Also increase the monitoring frequency of others in the home, say every 3 to 4 hours, taking temps, asking about symptoms as well so you can pick things up earlier. Of course, utilize gloves and protective personal equipment at this point, and that includes laundry and everything else. And if anybody does develop symptoms, report it immediately to the healthcare provider. I've talked a lot about staying up to date, and I want to remind everyone to look for trusted resources. Look at the centers, the CDC, the NIH, the WHO, not to social media outlets for the latest medical information. But also look at other organizations that you've trusted before. This is where you're going to find information that is IDD specific. Anchor, ANCOR.org, has done tremendous work in this field and putting people together and helping create policies and helping to influence legislation in this field. And they have a great resource guide on their page, at their website. Administration for Community Living, ACL.gov, has a tremendous amount of helpful resources. The American Academy of Developmental Medicine and Dentistry also has great resources, along with the Developmental Disabilities Nurses Association. For all of you out there who work in this field and are nurses, I highly recommend that you go to their site and also consider joining. And then if you're a direct support professional, the National Association of Direct Support Professionals, NADSP.org, is doing great work in helping provide information and supporting direct professionals. Dr. Rick Rader is a colleague of mine who is doing a lot of webinars and information for that organization as well, and I also highly recommend them. Besides the health risks, besides people just having health issues because of this disease, people with disabilities are at risk for losing supports. They may lose the support of a family member or staff because they become ill, their family members become ill, they have no one to help with childcare, or they become overworked and burnt out. Some of the agencies can be losing operating funds, and they might not be able to stay open or fully staffed, and they may not be able to even return after a pandemic. Some of the day programs that are having to shut down and they don't have funding, we don't know what it's going to look like. So there are risks associated with losing supports. And again, I don't have an answer for that, but there are a lot of people that are working to help keep this going, and I encourage you to be a part of that. Sometimes they may not fully lose supports, but there may be a reduction in supports, at least temporarily. We know that support coordination is occurring remotely in some places. That reduces a person-to-person support coordinator having face-to-face time. Suspension of the requirement for community time. Again, we expect that to be temporary, of course, but these things are reductions in supports. And again, reduced accessibility to healthcare could be an issue as well too. But again, there is great work being done. Providers are rapidly developing tools and protocols and policies and procedures. Legislation is allowing for increased funding for different types of arrangements and to ease financial burdens. And again, I would look to anchor.org for a lot of the legislative things that are happening out there. I'm going to touch on some general preparedness items that I think are important for everyone to be considering, really in any situation, not just in a place where people with disabilities are supported. We should be monitoring for signs and symptoms regularly and notify healthcare providers if they're present. We need to ensure an adequate supply of a person's prescription medications. 90 days if you can get it. Contact your local insurance companies to see if they will allow for that, but that way you have medicine on hand. Also keep a supply of what we call cold medicines, like fever-reducing medications and runny nose medications and things like that to have on hand as needed. Make sure that you have usable working thermometers available. If you can get the no-touch ones, that's great. If you can't, anything is better than nothing. Do what you can. Make sure you clean them in between. Also consider a pulse oximeter. That is readily available. They're very inexpensive. You can get them for $10 or $15 on the internet now. And if you're doing telemedicine, services, that type of information is invaluable to the healthcare provider on the other end. If you can clip that on a person's finger and it can tell you what their oxygen level is in their blood. I will caution you, there's a learning curve associated with those, and you don't need to be clipping on and reading the first number that you see. You need to make sure that the pulse is coordinating with the person's actual pulse before the reading can be considered accurate. So there are a lot of false positives that has caused a number of issues that I've seen throughout my years of working in this field, with people calling and saying, "Oh my gosh, this person's O2 sat is 50%," and I'm like, "Oh my gosh, what are they doing?" "Oh, well, they're sitting here eating lunch." Well, that's not going to happen. So be careful about that. Utilize delivery services for groceries and other household items. Always. At this point, it's recommended to wear masks when people are in group settings, and that, in my opinion, would include several people living in a home with support staff coming in and out. I think as best as possible, everyone should wear masks. Again, we know that some people won't tolerate things on their face. So we do the best that we possibly can. Have a list of emergency contacts updated and available. Identify areas in the home where people might be quarantined if needed. Get them ready, get them set up. Have people model calm and controlled attitudes and behaviors in the environment, because again, those types of things are contagious, and we want good and calm behaviors to be contagious. I want you to consider pets in the home. And I don't mean the fact that, okay, there's been a couple of animals that have been tested, they've tested positive. I don't mean the pet actually getting the disease, but think about if there's a dog that goes in and out of different people's rooms and someone has it and they sneeze and cough and they pet the dog, and they could be transmitting material to someone else who might pet the dog later. So think about cleanliness of animals, or limiting where animals in the home roam. Again, create or update a health passport. If you have them, update them. If you don't have them, I would highly recommend getting those in place. Model good hygiene. It's very important. If you want people to wash their hands, the staff should be washing their hands, and so on and so forth. We want to educate people with appropriate levels of information. We want to teach people that you support about good hygiene measures. And you also might consider creating quarantine kits, so that in the event someone needs to be quarantined, you have all of the things that you need right at your fingertips. So you might have a box that's filled with masks and gloves and gowns and all of those things, but also consider including an air mattress and bed sheets in case a staff member needs to be quarantined with them. And also a few snacks would be nice too. And I want to thank Free in New York, Family Residencies and Essential Enterprises at familyres.org for sharing this list through Anchor with us all. I think it's a great resource. As far as an educational resource, we want to educate people at the level that is most appropriate for them. And Green Mountain Self Advocates has created a document you can search. You can just simply search Green Mountain IDD education or something like that, and it will come. They'll come right up. This was a document about COVID-19 created by people with disabilities for people with disabilities. So this can be very helpful. It's available in English and Spanish. Continuing on with general preparedness, ensure whenever possible that people maintain their usual routines. Ensure access to medical care, and again, consider telemedicine. Take care with what is watched on television, because people can become overly anxious or agitated by what they see on the news. If all we do is watch the drama that's portrayed on the news all day long, none of us could help but being agitated, upset, worried, and frustrated. So please discourage people from sitting there and watching the news constantly. But you do want to stay informed about what's happening, and again, using those trusted resources that I talked about before. Utilize tools that you already have to identify who's at most risk. And one that I would ask you to consider, if you're not already using it, is the health risk screening tool. It's our company's tool. It's a web-based screening instrument that's developed to screen for health risks in people with IDD and other vulnerabilities. It covers 22 different areas of risk. But what's nice about it is it doesn't just identify risk. It gives you steps there that action steps to take to help to mitigate that risk. So I would highly recommend you looking into that if you're not already using it, or something, if there is something else out there that you're using. But remember to do that. There are reports available in the tool that can help identify which people are at most risk for a serious illness as well. If you want to find out more information, you can reach out at hrstonline.com. The federal and state requirements are always changing. I would encourage you to stay up to date on the regulatory changes regarding services that you're providing. Some of them are being amended or waived, but what I would really encourage you to do is to document any actions that you take that are different than what the usual standards require. 6 months from now, someone may want to know, why did you limit this person's social interactions, or why didn't you allow them to go here, or why didn't you do this? And it would be great if you could pull out documentation. Well, this is why, because we were under an order not to do that. So I would always recommend documenting any changes from what you typically do. In regards to staying updated, we here at Health Risk Screening, we have a clinical advisory team that consists of myself along with 4 nurses who work for us that have I don't know the number of years combined, and they probably wouldn't want me to say, but many years of combined experience working in this field. We put out special bulletins that are IDD related COVID-19 information. On our website, we have a free infection control video that can be used to train in the basics of infection control. We're going to have an upcoming bulletin about the importance of communicating that people with IDD are people first, and I'm going to mention a future webinar on that shortly. We also have the My Health Passport there. We have other e-learn and resources that can be used to train staff. We also have a book called The Clinical Pearls in IDD Healthcare, which can be a great, concise resource for both people who support people with disabilities as well as healthcare providers. Mentioning an upcoming webinar, AAIDD and HRS will be again partnering on Wednesday, May 6th at 4 p.m. Talking about disparities, perceptions, and misconceptions, putting people before their diagnoses. This is a very timely and important topic. We know that there are health disparities in people with disabilities. We know that there are lower rates of cancer screenings, and we know that some people may be considered to be lower on the ladder of people who might get ventilators and other types of intensive support. And so we're going to talk about these issues, as well as what can be done to help people have to be more in an equal playing field. So we hope you can join us for that. I would be remiss as a healthcare provider if I didn't tell you to wash your hands. Use sanitizers that have at least 60% alcohol. Keep your hands away from your face, your eyes, your nose, your mouth. Avoid close contact with those who are ill or infected. Stay home if you're ill. Cover your cough and sneeze, and regularly disinfect objects like light switches and keyboards and cell phones and eyeglasses. Why? Not because we're going to stop the disease completely, but we're going to try to flatten the curve so that we do not overwhelm the demand on the healthcare system, so everybody can get the healthcare that they need, which can actually reduce the death rate. If people can't get ventilators who need them, more people will die. A few words of encouragement. There is immense power when a group of people with similar interests gets together and works towards the same goals. Hardships often prepare ordinary people for an extraordinary destiny. When adversity strikes, that's when you have to be the most calm, take a step back, stay strong, stay grounded, and press on. Your hardest times often lead to the greatest moments in your life. And we will get through this in peace, calmness, cooperation, compassion, understanding, and perseverance will light the way. And I want to leave you with a picture of a colleague of mine, a good friend of mine, Dr. Malik Trivedi. He's in Jersey City Hospital in Jersey City, New Jersey. We were talking, and then he accidentally FaceTimed me shortly after that. And so I clicked this picture of him. And I think when we're talking about portraying peace and calmness and cooperation and compassion and understanding and perseverance, This picture says a lot. There he is in his mask and personal protective equipment, giving me the thumbs up from the hospital. And it's going to be okay, everyone. We will get through this. So I want to thank you on behalf of AAIDD and Health Risk Screening for joining us. We ask that you share this recording with others. You can visit us at hrstonline.com and aaidd.org. And I certainly wish you good health and wellness to everyone.